Now, the mechanism under prematurity can generally be divided into two. The first mechanism, you have hypofunctions of the organs. Is it clear? You have hypofunctions of the organ, and we have also, so the mechanism under prematurity is that you have hypofunctions of the organ, and you have the low birth weight. So those are the two major mechanisms which are located here. And low birth weight can also be related to the prematurity, as we are going to discuss later. Now, hypofunctions of the organ. You need to know that there are organs which are not functioning effectively in prematurity, and those hypofunctioning is what is going to result to additional complication that I didn't speak about in birth asphyxia, but that you need to understand in prematurity. You need to know that what for hypofunction we have the hypofunction of the hematopoietic system. In the hematopoietic system, there's going to be hypofunction such that is going to result to reduced production of red blood cells, is going to result to anemia. We have also a reduced leukocytes in blood. You can have reduced leukocytes in blood or reduced functioning of the leukocytes. And that reduced function of the leukocyte prone the children to infections. That's why in the hypofunctioning you have to consider premature to be prone to infection because of their reduced functioning. Now, still there, we are going to have hypofunctioning of the thrombocytes. Hypofunctioning of the thrombocytes. And the hypofunctioning of the thrombocyte is going to result to hemorrhagic disease of the newborn. You can have the hemorrhagic disease of the newborn because of the hypofunction of the thrombocyte. The next element, we are going to have also the liver, hypofunction of the liver. When you have hypofunctioning of the liver in premature, this hypofunctioning is going to result to the normally you need to know that the liver is going to store vitamin B. You have storage of vitamin B9 at the level of the liver. So you are going to have also anemia from low level of vitamin B storage. Here, the anemia that I was speaking about here, the anemia here is from low stimulation of the hematopoietic system. While the anemia here is as a result of low vitamin B9. So that is from hypofunctioning of the liver. Also, the liver is involved with the formation of the clotting factors. If there is hypofunctioning of the formation of clotting factor, you also have hemorrhagic disease of the newborn. So those are disorders which are treated with hypofunctioning. So those are the different disorders associated with hypofunctioning. Now we have also in prematurity we have also what is called low birth weight, and you have also to manage that low birth weight because that low birth weight is going to result to hypothermia and it's going to result to failure to thrive. And I've forgotten also another element in the hypofunctioning of the, we have also hypofunction the central nervous system that may result to premature having low IQs. So those are the different elements that you have to evaluate in the mechanism. Now, still in the mechanism, you have to put in mind that there are certain elements that has to be put in place. The first element in the mechanism is that you have what is called the gestational age, you have the chronologic age, and you have the corrected gestational age. Those elements are very crucial when you want to speak about prematurity. The gestational age refers to the time from the last menstrual period till the date of delivery. It is the duration in weeks from the last menstrual period to the date of delivery. Now, the chronologic age is a duration from the date of the delivery to the date the child is being seen. Date of delivery to the date the child is being seen. That is the chronological age. And the next one is the corrected gestational age. is the sum of the gestational age plus the chronologic age in weeks. Is it clear? So that's the corrected gestational age. Why is this corrected gestational age important? It is important because you need to know that at certain gestational age, there are certain hypofunctionings that may be seen, or there are certain function that may not be seen. So let's say corrected gestational age. If you have a child that is 28 weeks of gestation, was born at 28 weeks of gestation, you are thinking that the type 2 pneumocytes are not yet developed. They are going to be completely developed at 34 weeks of gestation. So what you have to do is that the child has to attain a corrected gestational age of 34 weeks of gestation before the child is completely spared of any disease from the lungs, any congenital disease of the lung. Basically, so those are the different elements that you have to evaluate. The corrected gestational age can help you to understand the level of hypofunction of different organs. And the major element is one, the respiratory system. For the respiratory system, you have to know that the type 2 pneumocytes are completely developed at 28 weeks of gestation, and the type 1 pneumocytes are completely developed at 34 weeks of gestation. So that's one important element that you have to know. So you can completely remove a child from oxygen after 34 weeks of gestation because the type 2 and type 1 pneumocytes are completely mature. And when you are less than 20 weeks of gestation, you have to give surfactant to the child because by that time there is no production of surfactant because there is no type 1 pneumocyte or little type 1 pneumocyte. Now, the second element is the genitourinary system. Genitourinary system is also another system that is going to develop lately, particularly in males, where you are going to have the testes. Normally, the right testes, the left testis descend by 7 months and the right testis descend by 9 months. That's why generally when you have prematures, you are going to have undescended testes. Basically, the undescended testis of the right side is going to be normal because it's normally supposed to descend by 9 months of gestation, while the undescended testis on the left side is normally supposed to descend by 7 months of gestation. Basically, so you have to wait for the corrected gestational age before you await the undescended testis. And if the testis have not descended within the next 3 months, it's going to result with cretoshidism and need to be operated. Now the next one, after the genitourinary system, you also have swallowing. When you are feeding the child, it is very important to know if the child is swallowing or not. The swallowing reflex starts as from 32 weeks of gestation. That is why children at less than 32 weeks of gestation is best to place them on nasogastric tube because they may not have enough, though they may have a mature sucking reflex, they may not have a mature swallowing reflex, which is going to result to an aspiration pneumonia. So you have a child after feeding, it start being cyanosed. You are thinking of the etiology of the cyanosis. It is because of the aspiration that the child is having as a result of the swallowing. That's why the best feeding that has to be given to these children is first nasogastric tube feeding, basically before 32 weeks of gestation. So those are the different elements, and then the next one are the reflexes, particularly sucking reflex. Basically, sucking reflex. The sucking reflex generally is going to be immature, less than 32 weeks of gestation. Is going to get transitory by 32 to 34 weeks of gestation, and it's going to be mature after 34 weeks of gestation. So generally, that's why you have to always place the nasogastric tube less than 32 weeks of gestation. So those are the sucking reflex. So these are the 4 major elements that has to be evaluated in children. And lastly, the 5th element is going to be the weight. Basically the weight gain, and that weight gain should be between 20 to 30 grams per kilogram per day. Basically, so those are the different elements that you have to evaluate for the mechanism of prematurity. After evaluating the mechanism of prematurity, you need to know now the etiologies of prematurity.